That's the sort of vicious cycle that we see, that people have decreased mobility, they're inactive, which leads to the obesity and the problem with weight gain. And as we know, obesity is one of the #1 risk factors for developing diabetes, hypertension, high cholesterol. And that then triggers the depression and the decreased quality of life.
Getting out of the bed is problematic. I mean, you roll. You don't just get up, you roll.
One way I try to reach people, my patients, because they're typically adults, is I say, you know what you're eating, your kids are eating. How you eat in your house is how your kids are eating. And do you want your child to look like you when they're as old as you are?
I wanted to attend my daughter's graduation because I was so immobile. I couldn't make it because of my weight. I felt when I get there, will I be able to sit, with everybody else.
Is it immobility that leads to obesity and obesity that leads to arthritis? Or is it arthritis that leads to immobility and leads to lack of movement around, taking in the same number of calories and getting obese? It's sort of a vicious circle. That's the problem.
When you need help to get up out of a chair, when you can't bend over and tie your shoes, especially when you're young.
It's the #1 cause of disability in the country. So people with bad joints find themselves lacking mobility, unable to continue to do what they need to do. And so therefore they find themselves losing work, losing activity, less active, less participants in life.
I got pain in my legs. I got a lot of pain in my knees and in my hips.
Obesity is linked with cancer. It's linked with hypertension. It's linked with diabetes. It's linked with joint disease.
But I can't see myself living out the rest of my life like that, struggling, when I can do something about it.